So skeleton of the heart means coverings of the, it is not bones, it is something else. The skeleton of the heart is called the pericardium. So whenever a question comes, describe the skeleton of the heart, don't start describing the thoracic cage. You are wrong. Examiner is asking pericardium, intimately covering. So here the heart is not visible. No coronary arteries are visible. No atria, no ventricle is visible because heart is still inside the skeleton, that is the pericardium. We have to cut and open the pericardium, then only we can see the heart inside. So the covering or the skeleton of the heart is called the pericardium. It is of two types. Outer is called the fibrous and inner is called the serous pericardium. So as the name is suggestive, fibrous means it is made up of collagen fibers. Tough, thick bundles of the collagen fibers. You can compare the fibrous skeleton with the D fascia you have done. The skin, superficial fascia and D fascia. So like the D fascia, it is the fibrous pericardium covering the heart from all the sides. Superiorly, inferiorly, laterally, posterior. Everywhere. So it forms a thick protective covering. A jacket and resting on the diaphragm. This is the musculo-tendinous partition wall between the thorax and abdomen, so it is called the abdominothoracic diaphragm. It is muscular at the peripheral part, but the central part, where the heart is resting on it, is called the central tendon of the diaphragm. Again, it is aponeurotic, sheet-like, devoid of the muscles, only fibrous tissue, crisscross fibers fashion is there. So what is aponeurosis? General anatomy classes. Whenever the muscle or the tendon becomes paper-like, sheet-like, flat, it is called aponeurosis. So you have to go into the detail of the general anatomy, all the terms we are using frequently. So don't take the general anatomy as a light. It's a very light book, but don't take it light. So it is resting on the central tendon of the diaphragm, which is having no muscle fibers. Question arises why it is not present. Why there is everywhere in the muscle? Why where the heart is touching, there is no any muscle? The answer lies in the inferior vena cava. Inferior vena cava on the right side pierces this central tendon of the diaphragm, coming from the abdomen, and it opens into right atrium, base of the right atrium. So there is a hole in the diaphragm, in the central tendon. This is made up of the aponeurotic tissue, and inferior vena cava is coming and pouring its impure blood into the right atrium. If there would have been muscles during inspiration and expiration, when it contracts, it may occlude the emptying of the impurity. Aponeurosis has got no muscle fiber, so there are no chances of contraction and blockade of inferior vena cava. That is the answer. So while you are doing the anatomy, you will came to know that God is great. It is not a work of any engineer, super engineer. Each and every part of the organ of the human body is so beautifully made that there are minimal or 0.1 chances of the default. So that is the anatomy. Why it is interested to me? This is the only reason. This is the only true science. You will learn 17 subjects to pass MBBS exam. 17, 1-7 out of 1 anatomy is there. All other subjects they are supposed. This is the only true. Whatever you are seeing in the D hall, same is in your book. So that is the true science is the anatomy. No alteration. You can't mix yourself. Not even a single word you can add of your own. Whatever God has made the body from head to toe, you have to learn, you have to explore, you have to dissect, and you have to remember. That is the anatomy, the novelty of the subject. So this is the reason why it passes through the central tendon and why heart is resting on it. So that is the same. So this fibrous pericardium, which is a tough membrane resembling the deep fascia anywhere on the human body layers. So its inferior attachment is with the superior surface of the diaphragm. The central tendon, this jacket or skeleton of the heart is fused with the superior surface of diaphragm. Laterally, this fibrous pericardium is not attached with the parietal pleura. Parietal pleura is away. Parietal pleura is also covering the superior surface of the diaphragm, forming costodiaphragmatic recess. This is the mediastinal part of the parietal pleura. This is the apical pleura. This is the costal pleura. This is the CP angle, crow beak-like angle, CP angle, costophrenic angle. Literally, costal pleura, why is it called costal? Because it is touching the inner surface of the, smooth inner surface of the ribs, with their intervening intercostal muscle, external, internal and intimate. So this is what is the parietal pleura. So this parrot beak-like appearance, this angle so formed is called CP angle, costophrenic angle. In X-ray of the chest, we always look here. Whenever there is a pleural effusion or fluid inside the pleural cavity due to any disease or any cause, because of the gravity, fluid start filling from this pill. Then it goes up. Usually it contains air, so it is black color. But when the fluid is there, fluid becomes white. It is a radio opaque. So then this parrot beak is not a black structure in the X-ray finding like this. The parrot beak, pointed, sharp. So because of the fluid in the X-ray, abnormal CP angle is this. This becomes white. And black starts above. Because lungs are black. Because air is there. Any fluid, any blood, it gives the white color. It is radio opaque in the X-ray. The heart shadow is white color. Lung is black. See the X-ray of the chest. So this parrot beak disappears in those patients who are suffering from pleural effusion or fluid is there, minimal or maximal. Then it is called the obliteration of the CP angle. The word we use, obliteration. It is no longer pointed. Obliterate means truncated. truncated, rounded. No sharpness has been left. That is called obliteration. So that is the X-ray finding. If you see the report of the X-ray, they will write. The radiologist will write obliteration of the CP angle. So it is so important point. So heart pericardium, there is a gap between the parietal pleura and the pericardium, fibrous pericardium. Same on the right side, same is on the left side. So left lung has got a cut. Right lung has got a free border, straight. But left is also having a sharp anterior border, but it is curved. This curve is called the notch. And who has made it? Heart, so it is called cardiac notch. Heart is a left-sided organ. 2/3 of the heart lies on the left side, only 1/3 lies on the right side. So it is called the left-sided. So in order to accommodate, and heart is also obliquely placed. The placement is not straight, it is obliquely placed. As in the botany you have heard, which ovary is obliquely placed in which plant, in which flower? Obliquely placed ovary. Nowadays the flowers, they are on full bloom. Anybody whose botany is good? Petunia, yes. Solanaceae. Family Solanaceae. So like petunia, ovary is obliquely placed, so it is also, heart is also obliquely placed. Because the apex doesn't lie in the lies in the midline. This is the midline of the body. Right side 1/3 of the heart, left side is 2/3 of the heart. This is the apex. The apex is not in the midline, it is deviated or rotated to the left side. The apex lies in the 5th intercostal space, underline. Apex lies in the 5th intercostal space. Internal thoracic artery bifurcates in the 6th intercostal space. Underline both the things. Don't mix it. Internal thoracic artery bifurcation is in the 6th intercostal space and apex lies in the 5th intercostal space. It is fixed point. Fixed point. So laterally there is a separation is there. Then when we trace this fibrous pericardium in the upper part or superiorly, so at this sternal angle, arc of the aorta starts and arc of the aorta ends. And anterior to this lies the pulmonary trunk. So these are the great vessels. Lying in the upper part, that is the largest artery of the body, that is the aorta. And anterior to the aorta is the pulmonary trunk. So they are the large vessels. So fibrous pericardium comes and it is fused with the large vessels. Tunica externa of the aorta and tunica externa of the pulmonary trunk is the fusion of the superior attachment of fibrous pericardium. If you trace it upward, it goes into the neck. And in the neck it is continuous with the pretracheal fascia, because trachea lies just in the sternal notch you have seen. Trachea. So fascia which is covering anterior to the trachea fixes it. So this fascia get also attached to this. So that is the superior attachment of what is fibrous pericardium. Inferior attachment. Inferior attachment is circumferential. All around the base of the heart or the diaphragmatic surface of the heart is circumferentially. Write down the word circumferential, means all around. Anterior, lateral, posterior. That is all circumferential. In the anatomy we will use this word so frequently, so many times. Circumferential. So that is the attachment. So why this fibrous pericardium was essential? Why this skeleton has been provided? Because if there is no any bone, why it is called skeleton? Because it is protective. It is shock absorber. In any anatomical position of the human body, whether you are doing lying supine or prone or recumbent or Baba Ramdev like head down and feet up, your heart remains in the fibrous pericardium. Its apex remains in the fifth intercostal space. It doesn't change in any of the position. That is the virtue of the fibrous pericardium. It keeps the heart in the anatomical position in any alteration of the posture. And it works well then. If its site is changing with the position of the human body, how it can work? So it has been made for without bones. So that is the fibrous pericardium. Fixed in such a way that heart doesn't move in it. It remains in it and works very well. If you see the outer surface of this fibrous pericardium, it is yellowish, fibrous, some fat may be there. Plus, this fibrous pericardium is separated from the parietal pleura on both the sides by two very important arteries of the internal thoracic we have done recently is the pericardiophrenic branch. You know the branch? This is the pericardiophrenic, the first substage. Remember first substage syllabus. Internal thoracic or internal memory artery. So this is the, now you are seeing what is the course, where it is going. Its name was pericardiophrenic. Means it supplies the pericardium plus phrenic means the diaphragm. But which surface, that is important. Anybody asks you, superior surface. Because for the inferior surface there is the inferior phrenic artery, the branch of abdominal aorta that will do in the abdomen. It supplies the superior surface of the diaphragm, so it is called the pericardiophrenic. So after supplying the fibrous pericardium, then this artery will spread over the surface, superior surface of the diaphragm and terminate by supplying it. Pericardiophrenic. And wherever the artery is going, vein is coming from that way and they are ascending upward. Like the vena comitans of the internal thoracic. The two veins, they accompany the pericardiophrenic artery. Bilaterally, same. So veins accompany the artery, they are called the vena comitans. So there are so many vena comitans are present. It is not present everywhere. Wherever it is required, wherever it is essential to arterial supply of a particular organ, only there vena comitans are there. Internal thoracic artery, the main artery is supplying the intercostal muscles, for which we are surviving. Without respiration, we will die. No blood supply to the intercostal muscle, no pump handle and the bucket handle movement of the ribs, we will die. Again the diaphragm, respiration, lungs, death. So these veins, they ensure the arterial supply to the phrenic or the diaphragm, accompanied by it. So that is the essential part. Pericardiophrenic. So this is the heart, so it is obliquely, it is the anatomical position. So this is the right side, left side, this is the right side. See this great vessel. Can you see this vessel? Can you see the two small blue veins accompanying it? So they are the vena comitans. See the obliqueness of the Now this is in my hand. This is pericardiophrenic artery with the two blue vena comitants. Because heart is left side like. So this is the left side. So the left side of the pericardiophrenic artery along with the vena. So this is such a big artery. Because the phrenic diaphragm, arterial supply is very, very important, diaphragm supply. Plus pericardium also, in which the precious organ is lying. So every care has been taken to ensure the blood supply of the diaphragm as well as the pericardium for this. Then another important thing about this pericardiophrenic is it is accompanied by a very, very important nerve. It comes from the neck, crosses the internal thoracic artery from lateral to medial side and accompany the branch pericardiophrenic right from here. And traverses whole of the course of the pericardiophrenic artery. And then this nerve enters into diaphragm. I think you must be knowing what is the name of this nerve. Phrenic nerve. Nerve supply of the diaphragm, which is very important in the movement of the diaphragm during inspiration and so both the artery and veins and the nerves they accompany. So when such things are coming in the human body is not present everywhere. Very few areas are there where the artery, vein and nerve accompany. And what we use the word for them? Neurovascular bundle. Neurovascular bundle. So this is the neurovascular bundle, one of the examples. So phrenic nerve accompanies it. And phrenic nerve is supplied by the blood vessel also. Pericardiophrenic also supplies the phrenic nerve, the myelin sheath. The artery supplying the nerve is called vasa nervosa. Underline it. Vasa nervosa. The vessels of the nerve. Vasa nervosa. This is the reason why phrenic nerve is accompanying the pericardiophrenic artery. Because phrenic nerve is very, very important for the survival, for the life, for the respiration, for the diaphragm. So it runs along with the artery so that each and every vasa vasorum should nourish the PVC covering or the myelin sheath of the phrenic to ensure it. So how beautifully the God has made each and everything. So that is the beautiful subject and order. That's it.